Hello everyone. This is the beginning of second series of small topics directed for undergraduate and postgraduate learning. For undergraduates, it can be important learning for performing in the examination as short notes. For postgraduates, it will provide an input for preparing classes for undergraduates. Now, prodrugs is a topic of today, and prodrugs are generally inactive forms of the drugs which are bioreversible, that is, activated in the body, and they are used to enhance therapeutic effectiveness. The purpose of prodrug use is to overcome biopharmaceutic, pharmacokinetic, or pharmacodynamic hurdles such as poor chemical stability, poor solubility, unacceptable palatability, lack of target specificity, pre-systemic inactivation of active drug, poor passage through biological membranes, particularly blood-brain barrier, and toxic potential of an active drug, or non-compliance because of frequent dosing. Now, these are few examples that will show the purpose of product formation. The example is increasing aqueous solubility. Isovuconazonium is antifungal drug that activated into body as isavuconazole alone by plasmaesterase. But the ammonium sulfate salt is water soluble. Then increasing tissue permeability by increasing lipophilicity. Several examples are there: tenofovir, sofosbuvir. Enhanced brain permeability, droxidopa, that is used for the treatment of chronic orthostatic hypotension. Increased transport and tissue uptake, gabapentin, enacarbil. This is a unique example of increasing transport. Prolongation of action is also done. Prodrug formation of the prostaglandin I2 analog, selexipag. Increased bioavailability, phytoteridine, that is anticholinergic for urinary bladder, azilsartan, and dabigatran. They are formulated as esters to increase the bioavailability and increasing local efficacy of a drug. Luminal efficacy of diloxanide furoate considered to be greater than diloxanide. The general characteristics of the prodrugs are most of the drugs are esters that are hydrolyzed in GIT or body fluids and liver. Some are chemically modified forms with additional moieties that are broken down in body. It could be phosphate or amino acid or related compounds. Others are precursors of the active drug that get converted into active drug itself, for example, levodopa. And sometimes a carrier molecule or an antibody is tagged with the drug to make a tissue directed to reach on the cancerous cell. Now, types of the prodrugs can be single entity, bipartite, or tripartite. And few examples exist for prodrugs of a prodrug. Now, single entity compounds are several examples are there in pharmacology: levodopa, ramipril, clopidogrel, metronidazole, omeprazole, resicatrozole, proliproxazine, nitazoxanide, carbimazole. There are several one actually. Now, bipartite are one where there is an inactive component or carrier which is chemically combined with the active drug. For example, furoate, that most of them are esters, diloxanide furoate. Some beclomethazine, dipropionate. Some of the phosphate derivative is added, for example, phosphiperitant, phosphenatoin. Many cephalosporins of second, third, fourth generation exist as esters for oral or parenteral use. Now, tripartite prodrugs are there is a linker between the inactive moiety and the active compound. One example is 5-ampicillin. A prodrug of a prodrug. We can call them as double prodrugs. It is levodopa is a prodrug and phoslevodopa is a prodrug of the prodrug. Mutual prodrugs or codrugs are those which get hydrolyzed or broken into two active compounds. So the prodrug acts for active drug 1 and 2 as the prodrug. Sulfasalazine has as a link between sulfapyridine and amino salicylic acid. We know sulfasalazine is useful in ulcerative colitis and also in arthritis. The reason is because it is broken into two active compounds. Binorylate is a prodrug for paracetamol and aspirin, and sultamicillin as a tosylate is chemically a single compound, and the full name is here depicted. It is a prodrug for ampicillin and sulbactam. It is not like amoxicillin clavulanate. It is different. Ampicillin and sulbactam are chemically combined to have the single entity as prodrug. In body, it is broken into ampicillin and sulbactam. One may note that sulbactam also has intrinsic antibacterial activity against Aerobacter. Many drugs are actually active per se and form active intermediates in body, and there are actually a large number of them. Representative samples are lisinopril, carbamazepine, bromhexine, codeine, propranolol. They all form active compounds. Now, prodrugs for different routes of administration are there. For example, oral route is the most common where prodrug formulations are done. But topical prodrug can be exemplified by dipivefrin, which is a dipivaloyl ester prodrug of epinephrine and is used as eye drop, and in eye local tissue converted by esterase hydrolysis to epinephrine, and so is beclomethasone dipropionate inhalation used in the treatment of bronchial asthma. The dipropionate ester hydrolysis results in formation of beclomethasone. Some prodrugs are for parenteral. For example, subcutaneous levodopa carbidopa subcutaneous infusion, phoslevodopa post-carbidopa subcutaneous infusion to avoid fluctuations in the response in Parkinsonism, intramuscular testosterone, undecanoate and testosterone propionate are oily salts or oily esters that are broken down into the tissues, in muscular tissues for absorption. Intravenous prodrugs are typified by a few drugs. For example, phosphenitoin is a water-soluble prodrug of phenytoin, currently used IV for status epilepticus. It is less irritating because its pH is little less compared to the phenytoin, which is highly alkaline solution. Fosaprepitant is a prodrug for aprepitant is given as a capsule while it is phosphate derivative, it is injectable. So just addition of phosphate or phosphonate derivative will make it more water soluble and injectable. Otherwise, aprepitant has to be given in the oral form. We know aprepitant is an important drug to control the vomiting due to anti-cancer drugs. Fosaprepitant 150 mg is equivalent to 125 mg of aprepitant. Therefore, it will be easier for dose calculations. Now, classification of prodrugs can also be done according to the site of bioactivation. Type 1 are those that are activated inside the cells. Type 1A are activated in a particular tissue, for example, levodopa in the extrapyramidal nuclei, substantia nigra, acyclovir into cancerous cells or viral cells, 6-mercaptopurine are the example of type 1A. Type 1B are the cells of the organs that metabolize the drug are activated actually. Cyclosinoid in lungs, enalapril in liver, heroin, primidone, solindac, They all represent the intestinal, GI mucosa, liver or lung as tissue for activation where they are actually acting. Now another example is dexamphetamine is activated to the dexamphetamine and L-lysine via peptidase mediated hydrolysis by red cells. So cells can also activate a particular drug. Type 2 prodrugs are those that are activated extracellularly in fluids. And subtype 2A, that is the one which is activated in alimentary canal, gastric juice, clorazepate, carbonicillin, intestinal wall, vancomycin, cefuroxime, levodopa to some extent, aspirin to some extent. Colonic lumen, the microbes can also activate sulfasalazine, sodium picosulfate. In liver, many drugs are activated, which are prodrugs, enalapril, aspirin. Type 2 are those drugs that are activated in systemic circulation, extracellular compartment. In plasma, bambuterol is converted into terbutaline. Mycophenolate mofetil, the mofetil variety is hydrolyzed. Phosphoenetone I talked about. Aspirin has multiple sites of activation. Sometimes drug is activated in urine. Methenamine mandellate is converted into formaldehyde in the acid urine and was used in the treatment of urinary tract infection. Type 2C is activated in target tissues and they are actually directed prodrugs, viral directed enzyme products, gene directed enzyme products and antibody directed enzyme products. One example is antibody directed enzyme product therapy called as ADEPT therapy. Two-step process is used. First is the antibody enzyme is administered that accumulates in the tumor cells. The anti-cancer prodrug is then injected so that it is activated by the enzyme which was already given. The activation is amplified. One molecule of enzyme can activate several molecules of prodrug at the specific sites. Alkylating agents are used by ADEPT technology. Post-absorptive activation is the most common way of activation of prodrugs, and example here is valencyclovir. Valencyclovir is a velyl ester prodrug of acyclovir that achieves 3 to 5-fold higher systemic bioavailability when compared to acyclovir. Increased bioavailability is due to transport across intestinal epithelium by human peptide transporter 1, which mediates intestinal passage. After absorption, it is bioactivated into acyclovir, achieving 3 times blood levels in intestinal tissue, in liver, and by a serine hydrolase, that is a human valacyclovirase enzyme which is present in the viral infected cells. Prodrug activation, there are several examples which are given in tabulated form. The tissue that activates and the enzyme that activates, and what is the active product form. Cyclosonide, biclomethacin dipropionate, enalapril, midodrine, irinotecan, physothiazide fumarate, dabigatran, exetel, bisacodyl, carbonicillin, indanyl, vancomycin, levodopa, codeine, latanoprost, prednisone, olmesartan, midoxomil, heroin, clorazepate, bambuterol, fenofibrate, pericoxib, desogestil are few representative examples that are activated in various body tissues in all the places where I will discuss as a site-specific activation and according to the route of exam. For details, you can go through these references which give a very good concept about prodrug, and they are mini drug reviews actually. Finishes with the prodrugs as a small topic. Next topic will be pre-systemic metabolism. We call it as first pass metabolism or first pass effect, and this will be available, the presentations will be available at my YouTube channel.